So ICH-Q8, pharmaceutical development. So this is CG and PMS through ICH. So it presents dosage from development as design rather than formulation process, and it defines the primary design input as quality target product profile. So the intended use, dosage form, dosage strength, and route of administration, container closure system. This is all discussed in ICH-Q8, pharmaceutical development. So pharmaceutical development, again, advances through ICH. So it defines the quality design output. So you get your critical quality attributes, your key material attributes, API and excipients, and critical process parameters. And it's just achieved through the application of design space, risk management, product cycle management, and continuous improvement. So if you want to get more information about quality by design, I do have a link for you to go watch this video after you watch this lecture so that you can get more information on quality by design by Craig Geegee. So ICH-Q9, quality risk management. So it defines regulatory expectation that appropriate risk management to be applied to pharmaceuticals. It applies solely to patient risk identification, elimination, and mitigation to maximize safety, benefit to risk ratio. It presents established processes and tools appropriate for pharmaceutical risk management. So this is a high-level overview of the quality risk management process. Again, risk assessment, within your risk assessment, you want to identify your risks and that analyze it and evaluate it. And then you go risk control is you want to reduce your risks and maybe accept it if you can't reduce it. And then risk review, you want to review the events associated with the risk. So this is just a high-level overview of risk communication and how you want to determine your risk management. So again, knowledge check we won't go over now, but should be tested. You'll be tested. I'll have this question in your test. So the ICH is a global organization. Is that true or false? Second question. Retrospective evaluation deals with the establishment of documented evidence prior to process implementation. True or false? So now we're going to process analytical technologies, or PATs. In this part, we'll define PAT, list the tools available, and provide examples of PAT applications. So the US FDA advocates process analytical technology, or PAT, as a strategy to develop a higher degree of process control. So PAT is used to have a higher control, and they have a guidance document for PAT as well that you can read. So quality cannot be tested into products. It should be built in or should be by design. So a key feature of PAT is that quality is built to the product rather than being tested before the release of product. The aspect of it is a system for designing, analyzing, and controlling manufacturing through timely measurements, such as during processing of critical quality and performance attributes of raw and in-process materials and processes with the goal of ensuring final product quality. So simply stated, watching a manufacturing process as it occurs, understanding and explaining any variations in the process, and using all this knowledge to predict quality at different spots to achieve the same results repeatedly. So that's the whole purpose of the process analytical technology. So PAT has a three-step process. It's design, so knowledge of your critical quality attributes and your CPPs. Then you want to analyze the CQA and monitor the CPP. And then you want to put controls to control the CPP to achieve consistent CQA. So this is the three-step process of PAT. So what do we mean by timely measurements? So timely measurement means at line, so sample removed, isolated from, and analyzed close to process stream. Online sample removed for analysis from process stream and return to process stream again. Inline sample number removed but analyzed in place. Offline samples removed and analyzed away from the process stream. And it's necessary for analytical results to be available in the time frame necessary to facilitate real-time decision making. So this is all about timely measurements, making uh, your um, or getting your measurements in a timely manner, so that you can make decisions easily in order to know how to move forward with your process or not. This is another video source that you can go to where Martin Gatsby discusses PAT more in detail. So some PAT tools is data acquisition and analysis, process analyzers, process controls, and continuous improvement and knowledge management. So these are all different tools you can use for PAT. Um, so this was just going over the tools that we've discussed. So you want to acquire your data and analyze it. So data is huge today, and being able to acquire that data and analyze it and be able to make decisions out that data in order to know how to move your process is huge. So that's one big tool of PAT. And then you want to analyze it, and institute controls in order to make sure that you are making sure that your process is in state of control. Because the last thing you want to do is to have things that are not in control, and FDA seeing this, you want to make sure that everything's is in control and you're preventing it from being a big mess and potentially contaminating or having to throw out product because you're not in control. And then continuous improvement. Just because you have your process designed doesn't mean you can't continuously improve it. You want to make sure that you're continuously using updated regulations, updated guidance documents, updated knowledge, updated data to be able to continuously improve your process so that you have the most robust process in place in order to help streamline and put out the most quality product. So this is an example of PAT tools applied to the API process steps. So popular techniques apply to specific API product steps. So your material receipt. So you might want to use a handheld scanner to say, hey, I scanned this and I received my material. And it notates the date, time, so that you know when you received it and if it was within expiry or not. Next, going into your reactor, you want to be able to monitor your process. So the pH, the chromatography, all these different things you can use to control your process steps. And then going into your filter, you want to monitor the particle size or the turbidity. So these are tools to help control that process. Dryer, again, you want to control it, whether it be through particle size or anything they have listed from the exhaust. You go into your mill and you finish API. So this is the specific process steps and different steps you can use to help prove that you're in control of your process. This right here is a high-level overview again. As you go into your material receipt to your reactor, the PAT tool is applied to each specific process to help keep it in control. This is going to your tablet, another type of process, your tablet manufacturing. As you're going through your dispensing, blending, milling, compression, and decoding, these are different ways you can keep it in control through, if you're dispensing, calculating the dry weight, going to your blending, the impurity, milling, the particle size, and then all the way to compression and tablet coating. These are ways to keep your process in control.